Welcome back. You know what blows my mind? Americans pay more for healthcare than any other developed country. And we've been told our whole lives it's because we have the best system in the world. But what if I told you there are countries where you can walk into a hospital, get treated by doctors trained at Johns Hopkins or Harvard, pay a fraction of what you'd pay in the States, and actually get better outcomes? I'm not talking about some fantasy. I'm talking about real countries with real healthcare systems that are quietly outperforming us while we're still arguing about insurance deductibles. Today, we're looking at 5 countries with better healthcare than America, and most Americans have absolutely no idea. We're talking shorter wait times, lower costs, better life expectancy, and hospitals that look like 5-star hotels. Stick around because our number 1 pick has a healthcare system that's been ranked the best in the world multiple times, and it's easier to access than you think. Before we jump in, do me a favor. If you love travel drama, healthcare tea, or just watching Americans realize the rest of the world has figured some things out, hit that subscribe button. It takes 2 seconds, and it helps this channel keep bringing you the content nobody else wants to talk about. All right, let's get into it. Number 5. South Korea. South Korea doesn't mess around when it comes to healthcare. This is a country that turned itself into a global powerhouse in about 50 years, and their healthcare system reflects that same intensity. Seoul is a city that never stops. Busan has beaches and mountains, and even smaller cities have infrastructure that puts most American cities to shame. Here's what shocked me when I started researching this. South Korea has universal healthcare. Every resident, including foreigners who live there legally, is covered under the national health insurance system. You pay into it based on your income, but we're talking roughly $100 to $150 a month for most people, and that covers pretty much everything. Doctor's visits, prescriptions, surgeries, cancer treatment. Compare that to the average American paying $450 a month for insurance that still leaves them with a $5,000 deductible. The quality? South Korea ranks in the top 10 globally for healthcare outcomes. Their life expectancy is 83 years. Ours is 76. Maternal mortality? They're at 11 deaths per 100,000 births. The US is at 32. And if you need something serious, like heart surgery or cancer treatment, South Korea's survival rates are among the highest in the world. Wait times are almost non-existent. You can book a specialist appointment for the same week. MRIs that take months to schedule in the US, you can get one in South Korea within days, and it'll cost you about $100 to $200 out of pocket if you're paying privately. Now, you might be thinking, okay, but what if I don't speak Korean? Fair question. Major hospitals in Seoul, like Samsung Medical Center and Asan Medical Center, have entire international patient floors with English-speaking staff. These places are so good that people fly in from across Asia for medical tourism. Living there long-term is doable too. If you're working remotely or teaching English, getting a visa is pretty straightforward. Rent in Seoul averages $800 to $1,200 for a 1-bedroom apartment, which isn't cheap, but you're in one of the most connected, efficient cities on the planet with healthcare that won't bankrupt you. South Korea's healthcare system works because the government regulates costs. Hospitals can't just charge whatever they want. There's transparency, there's competition, and there's accountability. It's a system built for people, not for profit margins. Number 4. Japan. Japan is famous for a lot of things. Bullet trains, cherry blossoms, incredible food. But one thing that doesn't get enough attention? Their healthcare system is phenomenal. And it's one of the reasons Japanese people live longer than almost anyone else on Earth. Japan's life expectancy is 84 years, one of the highest in the world. And it's not just that people are living longer, they're living healthier. Japan has some of the lowest rates of heart disease, obesity, and preventable deaths globally. Part of that is culture and diet, sure, but a huge part is accessible, high-quality healthcare. Everyone in Japan is required to have health insurance, and it's affordable. If you're employed, your employer covers about half. If you're self-employed or retired, you're paying somewhere between $50 and $200 a month, depending on your income. and that insurance covers 70% of your medical costs. The remaining 30%? It's capped. If you hit a certain out-of-pocket threshold in a month, the government covers the rest. Let's talk costs. A standard doctor's visit runs about $10 to $30. Prescription medication? Dirt cheap compared to the US. I'm talking $5 to $20 for things that would cost you $200 back home. Even major surgeries are a fraction of the price. A heart bypass in the US can run $70,000 to $200,000. In Japan, closer to $15,000, and insurance covers most of it. The quality is world-class. Japanese hospitals are clean, efficient, and staffed with doctors who are trained to some of the highest standards globally. You're not waiting 6 hours in an ER. You're seen quickly, treated respectfully, and you're not walking out with a bill that makes you want to cry. Tokyo has some of the most advanced medical facilities on the planet, but even rural areas have access to quality care. For foreigners, accessing this system is pretty easy if you're living there legally. Work visa, student visa, spouse visa, you're covered. Even long-term tourist visas qualify you for insurance enrollment in some cases. Rent in Tokyo starts around $800 for a small apartment, less in other cities like Osaka or Fukuoka. Japan's healthcare system works because it's universal, tightly regulated, and designed to keep people healthy instead of waiting until they're sick. It's preventative, it's affordable, and it's backed by a government that actually prioritizes public health. Number 3. Germany. Germany's healthcare system is one of the oldest in the world, and it's still one of the best. We're talking about a country that figured out universal healthcare in the 1880s, and they've been refining it ever since. Here's how it works. Everyone in Germany is required to have health insurance, either public or private. About 90% of people are on public insurance, which costs around 7.5% of your income, split between you and your employer if you're working. If you're retired or self-employed, you're paying the full amount, but it's still way cheaper than what Americans deal with. We're talking $200 to $400 a month for full coverage with no deductibles. Public insurance in Germany covers everything: doctor's visits, hospital stays, prescriptions, mental health, dental, maternity care. You're not filing claims or fighting with insurance companies. You're just going to the doctor and getting treated. The quality is exceptional. Germany ranks in the top 5 globally for healthcare outcomes. Life expectancy is around 81 years, and they have some of the best cancer survival rates in the world. If you're diagnosed with cancer in Germany, your 5-year survival rate is higher than in the US, and you're not going into debt to get treated. Wait times? Reasonable. You're not waiting months for a specialist. Most people get appointments within a couple of weeks, and emergency care is immediate. Hospitals are modern, well-staffed, and equipped with the latest technology. Germany also has some of the best medical research institutions in the world. If you need cutting-edge treatment, you're in the right place. And because healthcare is a public good, there's no incentive to overcharge or deny care. Doctors are paid well, but they're not incentivized to order unnecessary tests or procedures. For foreigners, getting access is easy if you're living there legally. Student visa, work visa, freelance visa, you're required to have health insurance, and you can enroll in the public system. Rent in Berlin averages $1,000 to $1,400 for a one-bedroom, less in smaller cities like Leipzig or Dresden. Germany's system works because it's been around for over a century. It's constantly improved, and it's built on the idea that healthcare is a right, not a luxury. Number 2, France. France has been ranked the #1 healthcare system in the world multiple times by the World Health Organization. And when you look at the numbers, it's not hard to see why. Let's start with coverage. France has universal health care, funded through taxes and Social Security contributions. If you're working, you're paying into the system. If you're retired or unemployed, you're still covered. Everyone gets access to care, no exceptions. The quality is incredible. France's life expectancy is 82 years. Preventable death rates are among the lowest in the developed world. Maternal mortality is a fraction of what it is in the US. If you need surgery, cancer treatment, or long-term care, you're getting some of the best outcomes globally. Here's what really stands out. In France, you can choose your doctor. You're not locked into a network. You want a second opinion? Go get one. You want to see a specialist without a referral? You can do that. The system is built around patient choice and accessibility. Costs are low. A doctor visit runs about $25 to $30, and most of that is reimbursed by your insurance. Prescription drugs are heavily subsidized. Hospital stays are covered at 80 to 100% depending on the treatment. Even dental and vision are partially covered. Wait times are manageable. You're not waiting 6 months for an MRI. Emergency care is fast, and elective procedures are scheduled within weeks, not months. French hospitals are well-funded, well-staffed, and they don't operate like businesses trying to maximize profit. France also invests heavily in preventative care. Regular checkups, screenings, vaccinations, they're all free or nearly free. The idea is to catch problems early before they become expensive emergencies. For foreigners, accessing the system requires legal residency. If you're working, studying, or retired with proof of income, you can apply for a long-stay visa and enroll in the healthcare system. Rent in Paris starts around $1,000 to $1,400 for a one-bedroom, cheaper in cities like Lyon, Toulouse, or Bordeaux. France's healthcare works because the government negotiates prices with hospitals and pharmaceutical companies, keeps costs transparent, and prioritizes universal access over corporate profit. Number 1. Taiwan. Taiwan has the best healthcare system most Americans have never heard of, and it's not even close. Taiwan implemented universal healthcare in 1995, and in less than 30 years, they've built a system that consistently ranks in the top 3 globally. Every single resident is covered under the National Health Insurance Program. You pay a small monthly premium, usually $20 to $60 depending on your income, and that covers everything: doctor visits, hospital stays, surgery, prescriptions, dental, mental health, traditional Chinese medicine, it's all included. Here's the crazy part. A doctor visit in Taiwan costs about $5 to $10 out of pocket. Prescription drugs, a few dollars. Even major surgeries cost a fraction of what they do in America. A heart bypass in Taiwan runs about $12,000 compared to $100,000 plus in America, and the outcomes are just as good, if not better. Taiwan's life expectancy is 80 years, higher than the U.S. Infant mortality is lower, preventable death rates are lower, and patient satisfaction is through the roof. There's a reason Taiwan's healthcare system has been studied and praised by policy experts worldwide. Wait times are almost non-existent. You can walk into a hospital, see a doctor within 30 minutes, and walk out with a diagnosis and medication the same day. No appointments needed for most things. Specialist referrals? You can usually get seen within a week. The quality is world-class. Hospitals in Taipei like National Taiwan University Hospital and Taipei Veterans General Hospital are equipped with the latest technology and staffed by doctors trained internationally. Medical tourism is huge in Taiwan because people from across Asia fly in for affordable, high-quality care. Taiwan's system works because it's efficient, transparent, and digitized. Your medical records are stored on a smart card that you carry with you. Doctors can access your full history instantly. There's no paperwork, no insurance claims, no billing nightmares. You swipe your card, get treated, and pay a tiny copay on your way out. For foreigners, accessing the system is easy if you're living there legally. Work visa, student visa, or even a long-term visitor visa qualifies you for enrollment after a few months of residency. Rent in Taipei starts around $500 to $900 for a one-bedroom apartment, and the cost of living is lower than most major U.S. cities. Taiwan's healthcare system is proof that universal coverage doesn't have to be expensive, inefficient, or low quality. It's fast, affordable, and it works. So, there you have it. 5 countries with healthcare systems that are objectively better than what we have in America: South Korea, Japan, Germany, France, and Taiwan. These aren't socialist fantasies or third-world experiments. These are developed, wealthy countries that decided healthcare is a public good, not a profit center. If this video made you rethink what you've been told about American healthcare, do me a favor and hit that like button.
Drop a comment and let me know which country surprised you the most. And if you want more content that pulls back the curtain on what Americans aren't being told, subscribe and turn on notifications. Thanks for watching. I'll see you in the next one.